Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey and let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your parents, spouses, family, friends, colleagues, coworkers, and everyone you know to listen to the show, available on podcast apps worldwide. If you have a question or an idea for a future program, share your idea with me by commenting on my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. You can also complete my caregiver survey or request a one-to-one consultation with me by going to my website, PamelaDWilson.com, clicking on the Contact Me button, and completing the survey. Welcome to episode 193. We are getting so close to 200 of the Caring Generation podcast in the Take 15 series, helpful tips and insights in 15 minutes or thereabouts. This week's episode is responding to elderly parent healthcare disasters. During this program, I'll share practical strategies and proven tips that I used as a care manager and professional fiduciary to manage and respond to unexpected client healthcare disasters or emergencies. So let me add a little background. The word disaster is relative to your situation. How often have you heard one say, "Oh, this is such a disaster. What a mess. I never thought this would happen." This is unexpected. This is the type of disaster I'm talking about. By using the word disaster, I am not referring to natural disasters like tornadoes, earthquakes, wildfires, tidal waves, or volcanoes. My goal is to help you get ahead of potential healthcare disasters or unexpected situations by knowing what to watch out for so that disaster does not strike. These elderly healthcare disasters include everyday conditions of elderly parents that are combined with memory loss, dementia, or Alzheimer's disease, and can result in unexpected things like falls or fractures. We're going to talk about the benefits of seeing specialists to manage health conditions and medications, plus how to identify the unexpected and unintended effects of those medications, which can have a much more significant impact than you might ever imagine. The examples I'm going to share include working with doctors, healthcare systems, and health insurance to figure out what's going on so that you can ensure loved ones get the best care. If you've been taking parents to see doctors, going for treatments, and so on, you know that the more interaction you have with healthcare systems, the more challenging care coordination can be. In today's virtual world, the staff you talk to on the phone may not physically be at your doctor's office. They might be in a different state or even another part of the world. If your loved one is relatively healthy, this information is super important because one day health can change overnight and you might find yourself unprepared to deal with a healthcare system that seems to have very little interest in helping you. If you're already in this situation, these tips and strategies can help. Let's start with a basic healthcare service. Having a primary care physician or a geriatrician that you and your parents trust. While this may seem common sense, it's not. There are a lot of people who don't have regular physicians. An ongoing relationship with a physician your parent sees once a year or maybe even every 3 to 4 months is very helpful when elderly parent healthcare disasters strike. The doctor already knows your parent and you. The staff in the office is more likely to be helpful, especially if a parent needs an insurance pre-authorization or needs to have a medication pre-approved. Working through these challenges with Medicare Advantage plans has been confirmed as a problem by CMS, the Centers for Medicare and Medicaid, who recently issued a final rule number 2004-00895. You can find the document in the show transcript on my website, PamelaDWilson.com, under this episode 183. This final rule prevents Medicare Advantage plans from delaying pre-authorizations or pre-approvals for treatment beginning in 2026. So a little bit of time into the future. The rule says that responses from Medicare Advantage plans must be received within 7 calendar days or less if there is an emergency. Timelines for pre-authorizations or pre-approvals are vital because persons over age 65 have multiple conditions like heart conditions, circulatory conditions that can result in strokes, lung or breathing issues, diabetes or cancer, plus dementia or Alzheimer's. For caregivers and patients, avoiding elderly parent healthcare disasters means understanding how all of these conditions work with each other. Research confirms that at least 50% of people over age 65 have 5 or more health conditions plus memory loss, dementia, or Alzheimer's. Persons with early memory loss that unfortunately may be undiagnosed, which is another disaster waiting to happen, can experience loss or weakening of physical function just like people who have diagnosed memory loss. This means difficulty with walking or balance, tripping on curbs, having difficulty walking up or down stairs, or even walking distances. It's interesting that healthcare researchers question if memory loss or other conditions predate falls or hip fractures. Let's look at what happens when a disaster, like a fall or hip fracture, happens. What is known is that if there is any memory loss, the trauma of hip surgery fast forwards the memory loss, and the person may never be the same. Doctors or surgeons who don't have experience with multiple health conditions combined with memory loss rarely counsel or advise family caregivers about these combined effects. Instead, after surgery, caregivers find themselves shocked at a loved one's physical and mental decline and wonder why no one said it would be this bad. While there's been some suspicion that the cause of worsening memory loss might be the anesthesia used in surgery, research also confirms it's more likely the physical event, the stress of the fall and the surgery, that is causing memory loss to advance. So if you have a parent who falls and breaks a hip and they have memory loss, know that you may see a very sharp decline in their mental capabilities after surgery. They may be more forgetful, less able to initiate activities, which can mean their ability to walk again and be physically active. They may be unable to return home and live alone. A high number, almost 50% of individuals over age 65 who experience a hip fracture die within the first year. So falls and hip fractures can fast forward one closer to the end of life. Now, in these cases, it's easy to want to be positive with aging parents and encourage them as much as possible. Honestly, your parents may want to return to their prior level of abilities, but mentally and physically, they might be struggling. Unless you've had surgery, it's impossible to realize its effect on the body and mind. Physicians or surgeons can describe the after effects documented in medical journals and studies. Until you experience surgery yourself, the things doctors tell you don't mean a thing To help you relate, if you're a caregiver and your friends and family are not caregivers, they have zero understanding of the work that you do, the physical and emotional effect of being a caregiver on your daily efforts. It's hard to imagine something you've never experienced. So concerning surgery for older family members, hope for the best. Realize the health condition of your loved one before surgery has a huge, did I say huge, impact on how they will respond after surgery. Returning to their previous activity level will likely take considerable effort over weeks and sometimes months. Another complication after surgery can be pain medications, or in some cases, medication to treat delirium, which can present as mental confusion or agitated behaviors. In many cases, persons with memory loss are prescribed memory loss medications and sometimes medications for behaviors. While medications help many health conditions, they can also cause more conditions because of individual sensitivity levels to the medication side effects. As the body ages, some types of medications cause more problems for older adults. Medications have to be processed by the body just like food. All medications pass through the liver, which metabolizes and processes the ingredients. Then the kidneys take over, and they excrete the medications. With age, the liver and the kidneys can become less efficient at doing their job. Elderly parents who don't drink enough fluids can become dehydrated. This can affect the liver and the kidneys. It can affect the body's ability to absorb, process, and eliminate food and medications. What often happens is that over time, one medication is added to manage the side effects of the first medication and the second medication. The next thing you know, if you or your parent is not proactive about asking questions or reporting side effects, your elderly parent might be taking 5 to 10 different medications, and they're not feeling any better, but worse. Let's talk about primary care providers or internal medicine physicians who prescribe medications for specific health conditions. This addresses the value of seeing specialists like cardiologists, endocrinologists, pulmonologists, and so on. These physicians specialize in medical conditions and medications. However, the problem adults over age 65 face is that their health insurance may easily allow or make it more difficult to see a specialist. The health plans are Original Medicare or Medicare Advantage. If people are federal or state employees or teachers, there may be other plans. So Medicare Advantage programs may lower overall costs, but they can restrict or manage care to keep costs low and insurance companies profitable. On the other hand, the United States government manages Original Medicare. So, making profits and keeping shareholders happy don't matter. You might pay a little more for Original Medicare, but you can see any doctor who accepts Medicare, any specialist who accepts Medicare. On the other hand, with a Medicare Advantage plan, you must stay within the plan's network, and it likely requires pre-approvals to see a specialist. So, knowing the difference between Medicare plans is very important. Back to the issue of who prescribes medications. Specifically for persons with Alzheimer's or dementia, a research study by Geisinger confirmed that a percentage of primary care providers who prescribe medications for dementia or Alzheimer's, like Aricept, Exelon, Razidine, Namenda, prescribe these medications inappropriately. Inappropriately means not at the proper dosage or frequency. So the result is taking the medications does not have the full benefit, the desired effect. It's kind of like throwing money for prescriptions down the drain. They're not doing any good. This misprescribing or misdosing can happen with medications that should be, or even may initially be prescribed by other specialists. So if you or your elderly parent sees a specialist who prescribes medications, make sure to go back to that specialist at least once a year to have your medications reviewed or more often. While it's really easy for your primary care physician or internal medicine physician to take over those prescription renewals, that may not be the best thing for you. Also, for persons with dementia, antipsychotic medications or benzodiazepines can have mentally disabling side effects that make the Alzheimer's or dementia seem so much worse. They can also have negative physical effects. So as a caregiver, as an older adult, it's critical to understand your medical conditions and the medications prescribed so that you can avoid healthcare disasters. There's really so much to discuss on this topic that it's impossible to address all the issues in a single show to help you avoid potential healthcare disasters, so there will be more to come in future episodes. Check back. I'll also include more detail in the show transcript for this podcast on my website at PamelaDWilson.com about the items we discussed. In the top tab, search for Media, then the Caring Generation podcast, and scroll down to look for episode 193, where you will find the show transcript. My best advice to everyone is to be very proactive about caring for elderly parents and loved ones. Caregivers, be especially proactive about your health to avoid the health issues of your elderly family members. While some issues can be hereditary, more of them result from lifestyle and daily habits. So if you choose good nutrition, exercise, and stay active, you are more likely to remain healthy instead of being diagnosed with health conditions that can complicate your abilities to live the way you want to live today and in your retirement years. I thank you so much for listening. This is episode 193 of the Caring Generation podcast, responding to elderly parent healthcare disasters. Check out my website, PamelaDWilson.com, for all of the Caring Generation episodes and show transcripts, plus 3 online courses, my blog, my book, ways to schedule one-to-one consultations with me or invite me to speak at corporate or group events. Please share this information with everyone you know so that we can extend the support, education, and love that so many caregivers and older persons who receive care need. I'm Pamela D. Wilson, caregiving expert, advocate, and speaker. I look forward to being with you again soon. God bless you all. Sending love and light to everyone. Sleep well tonight. Have a fabulous day tomorrow and enjoy each day. Stay healthy until we are here together again.
Tune in each week for the Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.